Well, coming up this Friday is World Diabetes Day. The disease impacts millions of Americans every day, often without them even knowing they're at risk. So joining us live this afternoon is registered dietitian Heather Spicer with the Toledo Clinic. Thanks for being here today. Appreciate it.
Thanks for having me.
Absolutely. So I think first and foremost, we all hear of diabetes, but you know, what exactly is it?
Yeah, it's a good question. Even people with diabetes sometimes don't know how to answer this question.
Yeah.
So in simple terms, it's how our food or how our bodies use food for energy, and there's some kind of problem with that. So when we eat, our body breaks food down into different components, one being glucose. Glucose will get absorbed into the bloodstream, and our blood sugar goes up. And then this signals the body to release insulin. And insulin helps to get the glucose from the bloodstream into the cells of our body.
Okay.
So I like to kind of think of it as like a key that opens up the door to get that glucose in. But with diabetes, there's some kind of problem with it. So it could be insulin resistance, which is like a sticky key. So it's there, but it's not opening. Or insulin deficiency, where you just don't have the key. Okay. So either way, glucose gets reabsorbed into the bloodstream, leading to higher glucose or higher blood sugar.
So for people who have it, then what does that really mean for them? Clearly they have to make some sort of adjustments.
Yeah, so we don't want high blood sugar, especially over time, because that can lead to a lot of complications. It can damage blood vessels, leading to complications like heart disease, kidney disease, eye disease, the list goes on.
Oh, wow.
And so we need to manage it. So there's usually 4 different categories that we want to think about to manage it. Food and diet, which is a big one. Exercise, activity, stress, which I think gets overlooked a lot.
Sure.
Because it can really affect your glucose. Yeah. And then maybe medications, depending on if that person
insulin
needs it.
or something like that.
Yeah.
But there are 2 different types of diabetes. You hear, you know, type 1 or type 2. What are those differences?
So type 1 is an autoimmune disease. So this is where the body attacks the cells in the pancreas that make insulin. So for these people, they have to be on insulin daily in order to manage it. Yeah. So back to the analogy, they don't have any keys, and we have to supply them. Type 2 can happen over time. So it's kind of it's a progressive disease. So that usually starts with that insulin deficiency or insulin resistance, and then can lead to that insulin deficiency over time.
So if you have type 1, unfortunately, that's not going away for you. There's nothing you can do there. Right. But for people with type 2, maybe there is something they can do to maybe get off insulin or something like that. Or you might be close to becoming diabetic, and you can prevent that.
Yeah. So 38% of people in the U.S. right now have prediabetes. Okay. The problem is most people don't know that. So getting screened, getting your glucose checked, A1C checked, so you know where you're at is very important because you can prevent it. So now with risk factors for diabetes, maybe being overweight, inactive, but then genetics, so family history, and then being over the age of 45. So there's only a couple things we can control in that category.
Right.
Diet and exercise, and I know we hear that a lot, but within that, we don't have to change everything. Okay. Small, sustainable changes are what lasts. So we don't have to cut out all the carbohydrates. We don't have to forget sugar forever. Really kind of learning what works for you, and those small changes that we can build upon can be very helpful.
Well, it's interesting because people might say, oh, diabetes, that means your sugar is high, so you just have to stop eating sugar. Yeah. A lot of people probably don't realize, carbs have something to do with that. Yeah. So if someone does get diagnosed with diabetes, how can they manage the disease?
Yeah, so we don't have to cut out carbs, but it might be how many carbs we're eating, could be what type of carbohydrates we're eating. Another stat for you, 95% of people in the U.S. do not eat enough fiber. So that's a great place to start. Okay. Higher fiber carbohydrates or just fiber-rich foods can be very helpful. A balanced plate, so making sure we have protein, those fiber-rich foods, healthy fats together can really help your glucose response after meals. So there's things, but usually it's not, once again, changing everything. Yeah. Little adjustments can make a world of difference.
Yeah, so the first step, though, is making sure you see your doctor pretty regularly so you can get those numbers checked, right?
Yes, absolutely.
And is there a specific number that you're looking for when you get those numbers?
Yeah, so if you're getting a fasting glucose, over 126 or above can indicate diabetes.
Okay.
An A1C check, which is a good average of how your blood sugar has been doing for about 3 months, limits. 5.7 to 6.4 is pre-diabetes. 6.5 or above is considered diabetes. So especially if you're in that pre-diabetes range, prevention is very important. Yeah. So we can prevent that diabetes.
Yeah,
diagnosis.
You don't necessarily want to put yourself in a situation for heart disease or all kinds of health complications that can result because of that. So some information there, phone number on the screen for the Toledo Clinic. Maybe this is you. You're like, oh, I just got my blood work done and I've been told that I have diabetes or pre-diabetes and I just need some help. I need a little nudging. I need a little help, maybe setting up a plan or some goals for myself. Get in touch here. Heather, thanks so much for being here today.
Thanks for having me.
Absolutely, yeah.